Welcome to my How Healthy Are You weekly educational podcast. My name is Dr. Thomas Brewer. I'm a PhD chemist and nutritional blood microscopist. This podcast is going to be on hormones or hormone health. Just a reminder, hormones are chemicals that are messengers. They help the body communicate between various organs, not to be confused with enzymes. Enzymes are also chemicals, but they increase the rate of chemical reactions. They make reactions go faster, whereas hormones are the communicating or messenger mechanism in our bodies. Both are extremely important. Normally, I just focus on talking about enzymes, but hormones are extremely important, in fact, just as important. So no matter how old you are, knowing your hormone levels and making sure your hormone levels are ideal is going to benefit you, and it'll also add to more longevity. The type of doctor you would normally utilize is known as a functional medicine doctor. So those are the ones to go to. Now, like I said, hormones are chemicals that serve as messengers in the body, and they relay that information to the various glands and organs. So you've got hormones that govern your thyroid gland, adrenal gland, pituitary glands in your head, and also the sexual glands, the ovaries and the testicles and the pancreas. So very important that they're the messengers between all these organs. So the natural reduction in hormone levels that we all get as we age, well, this also drives the aging process. So a lower hormone levels in general drive aging, and it works in both sexes, men and women. As you age, your body produces less and less of a pre-hormone called DHEA. There's also another hormone that we make less and less of. It's called pregnenolone. Now, the DHEA has a long name, and I think some of you may even be supplementing with it. So it's dehydroepiandrosterone. So very big tongue twister, and it's better just to refer to it using the acronym DHEA. But they're pre-hormones, and what that means is your body converts those two hormones into other major hormones, specifically testosterone, estrogen, and progesterone. So when you have less DHEA, you have less of these other hormones, and there's going to be a lot more skin aging, more body fat, less muscle, lower bone density, poor sleep, and, of course, sexual dysfunction. So a lot of this starts with the DHEA. We'll learn a little bit later. It also starts with cholesterol. So it's not about just about DHEA, though. Estrogen also dips during perimenopause, so this is just before menopause for women. And estrogen, believe it or not, helps prevent cancer. There's only one type of breast cancer that's estrogen dominant. The others are a result of lower estrogen. So low estrogen, you get bone loss and heart disease, and the risk of these killers rise as estrogen levels go down. Men also need estrogen. We face the same risks when estrogen levels go down. The bottom line here is we need our hormones to be in balance, and the greater the balance, the less aging. So if men's testosterone typically decreases with age, leads to osteoporosis, even cognitive impairment, all the way up to Alzheimer's. So very important. Now, there's this stigma about hormone replacement therapy known as HRT. And just the bottom line here is if you're going to use hormone replacement therapy, you want bioidentical hormones. You do not want synthetic. So that's just the bottom line there, and that's why the reputation's bad. When people use synthetic hormones, there's lots of problems because the body doesn't know what to do with them. So Again, it's best to get a lab test to check your hormone levels, back to the functional medicine doctor. Now, normally what gets tested, and a few of these, it's good information to change if you're doing something like testosterone replacement therapy. So for men, the PSA test, if you're taking testosterone and your PSA levels are increasing, stop the testosterone therapy. There's something else called hematocrit, same thing. If you're taking testosterone, stop it if your hematocrit levels rise. And like I said before, they'll test DHEA, which is a pre-hormone, and that's a good number to know because it typically decreases with age. So DHEA gets a lot of attention. It is a longevity enhancer, and there's been a lot of experiments that show that it's a multifunctional hormone, and it helps the immune system. It's very anti-diabetic, anti-obesity, anti-cancer, and it's good for our brains. It's a neurotropic, and it enhances memory and, of course, anti-aging. So a very good precursor. And unfortunately, DHEA levels decline as we age. When DHEA is low, it's linked to depression and higher risk of heart attack. So an important number to determine and do something about it. Most people think, well, I'll just get some DHEA supplements and I can't go wrong. Well, that can backfire. Some men have genes that preferentially turn an androgenic hormone, so that would be like DHEA, into estrogen, which means it would backfire. The man would be taking DHEA thinking he's going to raise his testosterone, and all he did was raise his estrogen. So we are all unique. We all have different genetic markers that are going to react with hormones in different ways. That is why, again, it's important to be tested so you know whether you should be taking DHEA or not. In most cases, it's a benefit because you're going to make more of the other hormones. So get a good test. Another hormone is known as oxytocin. You may not need to supplement with this hormone, though you can. It's a very good anti-aging hormone, and it's good with tissue and muscle maintenance and muscle regeneration. And that's what it's normally used for. When you have enough oxytocin, you'll have enhanced stem cell activation. So additional oxytocin tells the body, it makes the body think it's young and it's making more muscle, and it's going to use stem cells to do that job. All right, that's the good news. But it's easy to get more oxytocin, and one of the best ways is face-to-face communication. That stimulates the greatest release of oxytocin. The problem here is in the past 2 years, as a result of social isolation, we haven't been getting a lot of face-to-face communication, and this is going to affect people's longevity. Ways around this would be, now that we're back together, a massage, a long hug, an 8-second or longer hug, all boost oxytocin levels. And it's important to do these things. And while we were locked down, a lot of people weren't getting this face-to-face interaction, and it will lower oxytocin levels, which then there's less muscle regeneration and more aging. So bad thing. This is why social friends are important to our health and our longevity. So there's a chemical basis behind it, in this case a hormone basis. All right, what's hurting our hormones? So a lot of it is the poor diet and various exposures to environmental pollutants. So if we think about diet first, and we'll go to the environmental pollutants second, one thing to remember is the importance of cholesterol. Testosterone begins with cholesterol. That's the first chemical in the long series to make testosterone. But you synthesize every single sex hormone from cholesterol. So a heart-healthy, low-fat, low-cholesterol diet is very aging. I'll say that again. What we think is a heart-healthy, low-fat, low-cholesterol diet, we think it's healthy. It's very aging. Typically what we end up eating are omega-6 fats, which are very inflammatory, and in reaction, we really need good saturated fats, and I talked about these in previous podcasts. So if we think about carbohydrates, grain-based carbohydrates, the worst kind, they deplete our hormones, especially testosterone. Another strange fact, a lot of high carbohydrate foods, these are grain-based, the bad carbohydrate foods, these are not vegetable-based carbohydrates. Things like corn flakes and graham crackers, they were invented about 100 years ago to lower the male libido. A case in point, there was a Dr. Oz show from a few years ago. Before he cut to commercial, he said, guys out there, here's some foods that you should avoid because they'll lower your testosterone levels. So everybody's waiting through the commercial, and what does he have? He has this big tray full of muffins and bagels and donuts and bread-based foods, and saying these are what lower testosterone levels. So this has been known a long time. If men really took this to heart, they would cut way down on these grain-based carbohydrate foods, not the vegetable-based. So the Western diet, that when people say it's bad because of the saturated fat, there's some good in there as long as you get your saturated fats from the right sources. Another thing that hurts our hormones is not enough vitamin D. Easy. We talked about this. Just get 10, 15, 20 minutes of sun exposure. Where do you want to get your saturated fats from? Grass-fed red meat and pasture-raised organic eggs. That's where you want to get your cholesterol from. Fats, you want to get them from coconut oil or MCT oils. So fats are not bad. It's bad fats are bad, just like carbohydrates. Carbohydrates aren't bad. It's the bad ones that are bad, which would be the grain-based carbohydrates. Now, the environmental sources that really hurt our hormone levels, this is in the deodorants and lotions and shampoos and conditioners and shaving creams, all these grooming products. Most of them contain hormone disruptors, not all of them. And the chemicals in these, they actually mimic hormones in the body. And anytime you mimic a hormone, the body doesn't know what to do. It interferes with the function of the hormones the body does produce. There's two classifications. They're the worst offenders. One is called phthalates. Now, it's spelled Phthalates. Only a chemist would know how to pronounce that, but that mimics estrogen, and it accumulates in the fat cells. The other main classification are called parabens, and you'll see them listed in the ingredients, things like methylparaben or ethylparaben or propylparaben or butylparaben. So these are just different carbon chains on the paraben molecule. Anyway, you don't want these. You don't want to use products with these parabens or phthalates because they absorb right through the skin. Now, another bad thing in our diet is soy milk. Again, it mimics estrogen. Back to what we need, the good saturated fats from egg yolks, pasture-raised organic, coconut oil, MCT oil, grass-fed red meat. So you may have heard different ways of talking about these products. Sometimes you'll see how these are bad, but it's not all eggs. It's these pasture-raised organic eggs that you want. And it's not all saturated fats. It's the medium-chain saturated fats known as MCT. So it's possible to and necessary to have these good, healthy, saturated fats, and that's what's real important. Now, a couple things you can do other than hormone replacement therapy to increase your hormone levels, and so we'll call these hacks. On the basic side, everything I've been talking about the past few months will end up balancing your hormones. So the importance of good quality sleep and getting most of your carbohydrates from vegetables and also light sources. So the bad light, the junk light, is the fluorescent light, and the environmental toxins I've talked about in the past, and getting rid of those. All of that helps your hormone levels. But there's something you can do that increases testosterone, and it's really the most powerful way to do that, and that's with exercise. Very inexpensive. It's a great anti-aging treatment. So men and women will get an increase in testosterone and HGH, human growth hormone, just through strength training. What's recommended, what gives you the best bang for the buck is where you alternate high intensity with low intensity. So that's the HIIT, HIIT principle. So you have high intensity followed by low intensity. That could be 30 seconds, 1 minute, 2 minutes, 3 minutes, followed by the opposite in level of intensity. This also lengthens telomeres, very anti-aging. Another way to help our hormones is with an amino acid called L-tyrosine, and this is linked to thyroid issues, and a lot of people will have poor thyroid function, and the tyrosine helps upregulate their thyroid function. So it's something you may need, especially after getting tested. Now, you can get L-tyrosine in your diet. You can get it from pork, lamb, beef, and fish. Again, you want high-quality animal products, and that's really the key. So, quick summary: don't eat sugar and soy and excess omega-6 fats and these refined carbohydrates, because you want to replace them with grass-fed meat and the pasture-raised eggs and good energy fats. Exercise is extremely important, so that's something to do. You may want to supplement with something like L-tyrosine. I didn't mention, but vitamin D3 and zinc are other possibilities for supplementation. Big thing, though, go through your toiletries and your personal care products and make sure you get rid of everything that has phthalates or parabens. The best kind of doctor to see for this, at least to get your testing, they're known as functional medicine doctors. And in most cases, if you're over 40 and you're pretty confident you have low sex hormones, it's probably safe that you could get away with just supplementing with DHEA. Normal dosages are 25 to 50 milligrams a day, though I'd still recommend a lab test. So that's what I have for this podcast. Thank you for listening, and as always, please don't keep me a secret.